23 million kids out there, and the odds of having a healthy life are stacking up against them. The health of their future is compromised. We know that by the statistics. And these kids don't have the tools to help themselves reverse the mean cycles of obesity and social inequality. So we, as an interdisciplinary team of architects and public health researchers in Charlottesville, Virginia, designed a school environment in which every choice is a healthy choice, both from a food perspective and a physical activity and movement perspective. I like to think of this school as a model for 21st century health and something to inspire and replicate in communities like yours and elsewhere across the United States. So before I tell you what we did for the new school in this rural Virginia community, I'm excited to share about how we did it. We did it by engaging experts in public health and medicine, and we re-engineered the impact of design on health in our built environment for kids in this school. Dr. Terry Wong, who's the author of this incredibly innovative paper published in 2007, really changed the way that I perceive design as an intervention, and an intervention to enhance the capacity for healthy choices. So this perspective coming out of public health has totally rocked my design world, and I'm excited about being challenged by health as a design driver going forward. Terry was also, after 2007, really looking for a real-world project to assess the impact of some of those ideas, those innovative ideas in the paper. And in walks in Dr. Matthew Trowbridge, who is a pediatrician and public health researcher and a colleague of Terry's. And he had been using his incredible diversity of skills and experience as a pediatrician and public health researcher and closet design junkie. As an early advocate for change in the built environment, he really foresaw the power of frameworks like the active design guidelines and green health initiatives and programs like LEAD as an opportunity to expand the role of green health, to scale up the impact and to leverage the positive impact of those combined efforts, giving designers and architects an easy opportunity to implement some of these evidence-based strategies. So together we co-created and co-designed a set of evidence-based design guidelines. I'll be focusing on the food environment, but we have a physical activity component that includes the active stair and a number of other initiatives. And so we're very proud of this kind of prototypical venture of co-creating these design guidelines that were published by the CDC and then translated into architecture and built into this amazing school. So from this systematic, research-driven, evidence-based collaborative approach, we were able to develop strategies and tactics at multiple scales and organized them in a number of principles and objectives. So you can see here some of the small places and spaces that are designed into the school and how they're being used. I'll just go quickly through these for the sake of time, but the 5 core principles that pertain to some of the spatial domains kind of anchor the objectives of providing choices for kids and having that powerful evidence-based capacity to design options for kids. And certainly using the whole school, the buildings and grounds, to leverage that capacity. And scaling up to the community level, kind of articulating school space as a place of resource and multiplying the benefits of health for the community. So for example, in the 10 design domains, in the commercial kitchen zone, some of the tactics are to open up that kitchen and really celebrate the value of the role of food service professionals as educators to really create a demonstration space so kids are exposed to how food is prepped and made, and they have a direct personal contact with the people making it. Another important domain is educational wayfinding and signage. So harking back to Dick Jackson's powerful message about health messaging in our environment. Kids are some of the most vulnerable and absorptive young minds that we have, and they really look at everything we tell them via signage and whatnot, packaging, the billions of dollars that are spent encouraging kids to make bad choices. So we wanted to create a design antidote to that and really leverage the power of what we know communication can do in a school environment and make the health message complete and whole and comprehensive. So some of these factoids reside at places of choice where the kids have an opportunity to choose, and they're learning something about the healthy choice that they make as it pertains to their bodies, their communities, and sustainability. And then just fun ways to encourage even something as simple as fresh water instead of sugary beverages, using that signage as a design tool. And most important, working with the educators at the school. So in 2010, the same year that the Healthy, Hunger-Free Kids Act passed in Congress, the Buckingham County community in rural Virginia decided to partner on this initiative and prioritize design and health for food smart kids. So we were blessed to work with this community. And people like Penny Allen, who this quote is from, was there at the very beginning. And we're noticing that in our findings that one of the most important aspects of trying to implement change at this level is having educators, kids, and teachers at the table at the very beginning to help co-create those solutions. That means when things are up and running, that adoption phase is lessened. They're more likely to optimize the use of those environments and implement new programs and wonderful things that they can do to promote health. So because of Penny and the team, this active, kid-centric school focused design on what kids need in order to learn, grow, and get a healthy start in life. So we know they need to move, they need to play, they need to have positive social experiences, they need natural daylight and a lot of views to nature, and also just beautiful, inspiring spaces that really speak to a variety of options, even for postures and ways of sitting. And the bridge in this project helps leverage that as well. And they also need to experience food in innovative ways and in novel learning spaces. We believe this creates success not only in school, but in promoting healthy lifestyles beyond school. So when planning to consolidate 3 small elementary schools into one new K-5 campus in the county, they decided to repurpose 2 existing mid-century modern schools on about 40 acres, 30 acres. And our project encompassed a redesign of about 14 of those acres via a renovation and addition. And one of the kind of primary moves was creating an addition here that connects the existing schools, K2, 3, 4, 5, creating a comprehensive kind of active landscape for the campus, connecting those 2 schools with a bridge, an all-glass bridge, and then situating those shared spaces like the dining commons and the library and other key spaces to make that the heart of the school. And that really helped create a focus on food. So now Buckingham can claim a lot of initiatives, including teaching our next generation of environmental and health stewards, and also having a grand piazza for all of those great community events that Dick Jackson mentioned, having that social cohesion. I know that the community uses the school, the large spaces in the schools, everything from weddings to funerals, so it's kind of a center of the town now. So using the guidelines, which was a bit of a struggle to come to as 2 separate disciplines trying to work on a common language. We then had to use the guidelines and try to reimagine and reconceptualize what a 21st century dining experience needs to be for kids in a vibrant, active, open learning environment. So, and this reminded me a little bit of Dan's call for spaces to allow certain functions to happen. So essentially this entire piece, which is that centerpiece, is what we're calling a foodscape, or a dining commons as a learning environment. And you can see all these different places, indoor and out, the critical adjacencies created by a teaching kitchen next to the commercial kitchen, the food lab, the community meeting room, kind of all interstitched throughout this space to provide that variety of an opportunity for teachers and families and community. So we had to think a lot about the indoor and outdoor connections and looking at some of the garden opportunities. This is an early rendering, a conceptual rendering of some of those affordances that we could create indoors and out. And that is when the school first opened, the landscape at that point coming up. So that outdoor dining terrace connected to an outdoor classroom right next to the gardens allows them to engage in the activity of learning in the school gardens, both from the growing perspective and the harvesting, and then that can be taken into the teaching kitchen. May or may not end up in school lunch, but it does afford them that opportunity to learn in those novel spaces. We also have a palette of edible fruits and vegetables that are local, so grab-and-go gardens on your way out to these spaces with blueberries and such. We really opened up the whole environment so that the commercial kitchen really functions like a demonstration kitchen. It's designed and optimized for fresh fruit and vegetable storage, a lot of scratch cooking, and kids get to see the making of the food in the teaching kitchen. So there's the kitchen lab, which is a smaller space that allows for a lot of different small programs to come in without interrupting the commercial kitchen flow. An early rendering showing the connection between the compost center where the tray drop is, that open kitchen, the teaching kitchen, flexible furnishings, and the food lab back here and all the natural light. And the built environment that shows that flexible furniture, which allows the kids to come up with different configurations. It's a really vibrant space that changes all the time. The open serveries and the visual connection, and also that flexible and mobile equipment that allows for ongoing transformation of how food is served. They use smarter lunchroom strategies for food display and promoting choice. There are visual components, projection screens, and then the community meeting room allows for those farmers and local community members to come in and teach. And so the compost, it's a dehydrating composter that's in here, so it allows the kids to collect their food scraps and take it right back out to the garden. And the food lab, which is adjacent to the corner bakery. And this space was really intended for a lot of project-based, kind of student-driven experiments, everything from kindergartners to fifth graders, sharing their projects and testing and balancing all kinds of things that they're planting and growing and learning about. And an overall view showing the corner bakery at the corner. And one thing I've really enjoyed every time I go there and eat with the kids is the incredible aroma of that space. It's very amazing and inviting, and the fresh pasta sauce and vegetable soups creates a really homey and cozy atmosphere and relaxing. And then being able to have the active stair be this amazing kind of social device that you can see from the dining commons. It's a really vibrant place of social interaction. We were able to achieve the pilot credit for active occupants with this piece, and it's become a really heavily used feature. And then the outdoors and the indoors really combining to create the school as a community asset for farmers markets and all kinds of other community events that promote health at the community scale. So the findings are early. There are 4 papers that will be coming out in the next little while, but I just wanted to touch on some of what we're learning from this project, which is primarily looking at the healthy eating attitudes, behaviors, and perceptions of school space, and how policies and practices are shaping in response to the school design. So we did not, just to be clear, we didn't get involved with menu planning or procurement practices. This was more looking at the built environment, retooling it, seeing how behaviors change as a result. And so what we found with teachers and students, staff and faculty all across the board are 3 levels of change. And I'm speaking outside of my discipline right now, so I'm just going to go quickly. But social and organizational change, and I'll talk a little bit about what we saw happening. Awareness of and influence of space, which are some of the amazing things that children see and how they adopt healthy messaging and the use of those spaces. And then some of the psychosocial and behavioral outcomes of this project. So some of the new policies and programs that popped up within the first year of the school opening were gardening programs, both in the school and with the community, having multi-generational participation from the senior citizens and the grandmothers and grandfathers of kids in the school. They instituted a healthy play program in the primary school, so that includes curriculum integration, a lot of movement throughout the day, and using all those spaces to take 10 and 5-minute movement breaks, and they changed the organization of recess in combination with lunch as a result of what the design allowed them to do. They implemented nutrition programs and enrichment programs and using the teaching kitchen and those small spaces. They started to incorporate healthy eating messages in the morning announcements, talking about school lunch and those healthy options that are waiting for them at lunchtime. We saw a big increase in teachers participating in their own self-organized incentive programs. They started a Biggest Loser contest. All the teachers were excited about losing weight when they moved into the school because there's a lot of walking, and now they have a stair policy where you have to use the stair. They started a CrossFit after school program. The teachers are using all the eco walks that are in the landscape to take breaks and healthy active breaks for themselves. They changed their healthy snack policy. These are all, they seem small, but they're really, monumental when you think about the before and after conditions and the messaging. So, and we saw a big decrease in fat intake over the first year with the teacher cohort. And then just looking at the awareness of and influence of space, and this comes back to how people optimize the spaces we create for them. So there is a lot of evidence showing that when you do design something well and can make it useful and easy to use, teachers in these contexts are more likely to do so. And they were really, really excited about getting the gardens going and starting to integrate that food curriculum into their everyday practices. And then there's been a really cool shift in how they see active space. So the furniture is definitely a part of that, having ergonomic, flexible furniture that promotes activity and movement, but they are moving furniture around a lot and creating new settings. So there's this idea of active management versus, control of kids. So really getting kids involved and making those spaces and making movement a part of how they learn and how they use their school. And then some of the qualitative work that we are really blown away by it right now, and we're still kind of digesting and doing analytics around, are the mapping exercises that the students have done over 2 years. And what we are starting to see, and what we're, in a simple way most happy about, is that the kids absolutely love the school. So rule number 1, you have to want to go to school, and then when you capture them, it should be a healthy school. So we're happy that, they think this is the best school ever, and they don't want to leave. They've asked to spend the night there. They don't want to leave for summer break. And they're starting to really show signs of how they perceive space and social meaning. So we're really excited about the ongoing change and cultural transformation that we'll see in the school, because the kids over time will start adopting the space as their own and creating that meaning out of it. And so when you see a drawing like this, food is good, and the kind of colorful references to the design elements that have a communication capacity, at 12 months, that's a really, really early sign that we're excited to see kids really starting to own the space, which again, as Dan said, it's really critical that kids feel like the school is theirs and it's designed for them and they're responding to it in a very powerful way. So to get more information and to kind of join our movement, we created a website called We Move Schools Forward. You can go to that site, download the guidelines, watch a film that the Robert Wood Johnson Foundation made, where you can hear from the principal, Penny Allen, and Matt Trowbridge is interviewed in that as well, and you can kind of hear from their perspective how powerful these lessons are in this project. So thank you very much.
So my exciting topic is indoor air. Just thought I'd show you something. This is this room right now, and this is the building management system. And we're at about 680 parts per million of carbon dioxide in the air. In the whole first floor area, we're running at about 470 parts per million of carbon dioxide. So my name's Gavin Gotti. I have been in this field in a variety of capacities, from design through building operations, through building management, through construction, for about 40 years now. I semi-retired about 2 years ago, and I'm doing these kinds of things, some lead projects, do detailed life cycle cost analysis. Really am focusing on how buildings operate and maintaining them so they operate efficiently. What we try to do is bring expert level approach to clients and design firms to basically help them hit the target and the point. Unfortunately, a lot of our work efforts hit the target